If you're experiencing pain due to a rotator cuff injury or shoulder osteoarthritis, you're not alone. These conditions can cause discomfort, reduce mobility, and impact your quality of life. But the good news is exercise-based rehabilitation can help. My name is Dan Gillespie and I'm a physiotherapist and part of the Arms Up research team. In this video, we'll introduce you to a safe, structured approach to shoulder rehabilitation through 3 key phases of treatment. Now let's take a closer look at how we can support your shoulder recovery step by step. Next, we'll go over some general principles to think about when performing your shoulder exercise program. In general, it's safe to exercise a painful joint. Movement keeps muscles functioning and reduces chance of developing stiffness. There are some good general principles to follow when exercising. Good posture and technique is key throughout all exercises. Avoid pushing into sharp, pinching pain or catching with your exercises. Soreness after activity is okay as long as it settles within a couple hours after performing the activity or by the next day. If you're performing the right exercises, your pain should start to feel better or decrease over time. You can also use heat or ice to manage post-exercise soreness as needed. It's very important to keep up your home program. Remember, rehab doesn't stop here. If you have specific functional goals, especially if they are demanding like work or sport-related demands, further rehab and progression is best guided by a physiotherapist. If you have chronic changes in your rotator cuff or even a tear, maintenance exercise is important to managing your pain and maintain your function. Consider your exercises like medicine for your shoulder. You may regress or get weaker if you stop exercising, and symptoms can come back. Also remember that the exercises covered in this video are provided in the handout on exercise-based shoulder rehabilitation given to you at your appointment. Now that we've gone over some of the important considerations when performing exercises at the shoulder, you may be wondering which exercises are best. In general, a good shoulder exercise program should include or begin with range of motion and posture exercises for the shoulder, followed by gentle resistance exercises, strengthening the rotator cuff and muscles acting on the shoulder blade. This should be followed by a move to more functional strengthening or more advanced strengthening exercises. Next, we'll go over the 3 phases recommended for shoulder rehab. Poor posture leads to weakness in the muscles that anchor the shoulder blade to the spine and ribs. If these muscles are weak, the rotator cuff has to work harder and under greater strain. The focus of phase 1 is decreasing pain, improving postural control and range of motion. Daily range of motion exercises are important to prevent stiffness and improve flexibility of the soft tissues around the joint. Next, we will give a demonstration of the exercises included in the phase 1 program. The first exercise that we'll go over is called scapular setting or shoulder blade setting. This exercise is important to promote good posture. To do this exercise, you'll want to have your hands and arms resting on your lap or on top of a pillow or on top of a table. Once in this position, you'll want to squeeze your shoulder blades together, hold for a count of 5, and then relax, repeating for 15 repetitions. This exercise should be done 2 to 3 times per day. You also want to avoid having your shoulder blades come up and towards your ears during the exercise, and making sure that your head is looking straight forward and you're bringing your shoulder blades together, holding for that count of 5. The next exercise we'll talk about in phase 1 is called the pendulum exercise. This exercise can be really helpful to improve range of motion of the shoulder while also relieving shoulder pain. To perform the pendulum exercise, use your non-painful side to support yourself on a counter or tabletop, allowing your painful arm to hang freely down at your side. Once in this position, create small circles about the size of a dinner plate, allowing your arm to hang freely down, almost like your arm is a dead weight. You can move your arm clockwise or counterclockwise depending on what is most comfortable for you. From this position, you can also do small forwards and sideways direction movements. Perform this exercise for about 30 to 45 seconds, 2 to 3 times per day, or whenever your shoulder is sore or aching. The next group of exercises we'll go over in phase 1 are called active assisted range of motion exercises. These exercises can be performed with a wand or cane and involve using your non-painful side to help stretch out your painful shoulder. To do this exercise, grip your wand or cane with your non-painful side and then have your other side with your elbow bent to 90 degrees and the elbow tucked in at your side. Grip the wand or cane with your hand and slowly stretch until you feel a slight pain or pull in the shoulder. Hold this position for 3 to 5 seconds and return to your starting position. You'll want to perform this exercise for 10 to 20 repetitions 3 to 5 times per day. Make sure that you maintain good posture while you're performing the exercise. Make sure to keep your elbow tucked in and don't allow your body to twist or your wrist to bend back when you're stretching your shoulder. Make sure the movement is happening at the shoulder. The next active assisted range of motion exercise we'll talk about in phase 1 is for flexion movement. To do this exercise, you'll want to use a wand or cane again and lie on your back. From this position, you're going to use your non-painful side to help stretch your painful shoulder. From here, with your arms at chest level, you're going to reach up, again using your good arm to assist your sore arm, and move your arms overhead until you feel a stretch. You're going to hold this position again for 3 to 5 seconds and then return to the starting position. You can perform this exercise between 10 to 15 repetitions 1 to 2 times per day. Trying to go a little bit further as your shoulder is getting stretched out. Over time, see if you can increase the amount of work your sore shoulder is doing while performing the exercise. Another similar exercise you can do without using the cane involves using your strong arm to support and move your affected side. To do this, you can begin by lying on your back. Use your strong hand to support your sore side. From this position, you can lift overhead and gently stretch until you feel a pull in your shoulder. Once you feel a stretch, hold for a count of 3 to 5 seconds and return to the starting position. Remember when doing this exercise to avoid any sharp or shooting pains, and just go until you feel a gentle stretch or pull in your shoulder. Over time, see if you can slowly improve your range of motion by stretching a little further into the range, if able. Similar to the other exercise, you can perform this for 2 to 3 sets of 10 to 15 repetitions, 1 to 2 times per day. The next exercise we'll go over is called the passive table slide. To do this exercise, you'll need a small towel and a chair seated close to a table. To do this, you'll want to be facing towards the table with your hand on top of the towel to reduce friction and allow your arm to slide freely on the surface. From this position, you'll want to maintain good posture, bending forward at the waist, and slowly stretching your arm out until you feel a stretch in your shoulder. Once you get to the end of your range of motion, you'll want to hold this position for 3 to 5 seconds and return to the starting position. When you return back to the starting position, you want to make sure that your arm is relaxed and not pulling hard on the towel. So you're going to slide out, hold for 3 to 5 seconds, let your arm relax, and use your body to bring your arm back to your starting position. You'll want to do this exercise for 10 to 15 repetitions with a 3 to 5 second hold. The next exercise
1 to 3
we'll
times
go over
per
in
day.
phase 1 is called the passive. The last exercise we'll go over in phase 1 is also an active assist range of motion exercise. And instead of using a cane or dowel, you can simply use your other hand to help stretch your shoulder. To perform this exercise, make sure that you're seated in an upright posture, shoulders relaxed and back. Again, using your non-painful side to stretch your painful shoulder. To do this, you can interlock your fingers together and slowly raise your painful shoulder until you feel a stretch or pull. Remember to avoid any sharp or shooting pain or catching. Hold this position for 3 to 5 seconds and return to the starting position. You'll want to perform this exercise for 10 to 15 repetitions and again 1 to 3 times per day.